Good evening, doctors. Welcome again. And today we are going to discuss about pulmonary tuberculosis MCQs and their explanation also. This is a very high yield topic. In any exam, you are going to receive one question from pulmonary tuberculosis. So let's start our discussion. Yeah. Anti-TB drug that has bactericidal and sterilizing effect on tissue is. So answer here is rifampicin. Why rifampicin? Let's discuss. Rifampicin is a bactericidal antitubercular drug that kills both multiplying dormant bacteria and hence it sterilizes the tissue. Whereas isoniazid is effective against multiplying bacilli. Remember, ethambutol is low dose bacteriostatic, high doses it is bactericidal. Whereas pyrazinamide is mild bactericidal drug but property of killing bacilli acidic environments such as macrophage and areas of acute inflammation. It crosses the blood-brain barrier. So guys, I hope till here we clear. Now moving on next MCQ. Following type of pulmonary tuberculosis is most likely to be associated with acid fast bacilli sputum positivity, that is cavitary. Let's discuss why so. Okay. Now, cavities represent necrosis of tissue resulting in communication of infected material of airways. The bacteria thus discharge the bronchial tree from where the cough out the sputum. Infected material can cause tubercular bronchopneumonia in host by spread of other lungs or gastrointestinal tuberculosis by means of swallowed secretion. The risk to spread to the other individual is very high with cavitary tuberculosis. Okay. Now, following anti-TB drug is associated with major visual side effect. I and E for eye, E for ethambutol. So major visual side effect is by ethambutol. This is my trick. So please remember now. Hepatotoxicity is the most common side effect of anti-tubercular treatment. Isoniazid, rifampicin, pyrazinamide are hepatotoxic, but ethambutol is not hepatotoxic. Isoniazid may cause sensory neuropathy, optic neuropathy caused by ethambutol. Okay. Rifampicin may itching first 2 weeks and may cause thrombocytopenia. Ethambutol can cause retrovalvular neuritis, which in some cases may be irreversible. So hope guys it's clear for you. Now, empyema necessitans is its extension of empyema to the thoracic cage. So hope guys will discuss. Empyema necessitans is an uncommon manifestation of TB when TB empyema extend to the thoracic cage. Okay. Now, fibrocavitary lung lesion on X-ray is a feature of post-primary tuberculosis. Okay. Let's discuss. Primary complex is a small area of consolidation subpleural parenchyma. Post-primary tuberculosis occur in immunocompetent host and causes seizating granulomas. The seizous material get drained out through bronchi, resulting in small cavities surrounded by fibrosis, lung abscess, thick walled cavity on X-ray. Okay. Now, miliary tuberculosis on CT scan has lesions randomly distributed measuring 1 to 2 millimeters. So hope it's clear. Miliary tuberculosis is caused by hematogenous spread of tubercular bacilli. Has characteristic appearance on CT scan on chest with randomly distributed lesioning measuring 1 to 2 millimeters. Okay. Gons focus is usually subpleural. Gons focus is subpleural. Okay. Mantoux test positivity indicates prior exposure to the individual to Mycobacterium tuberculosis. Okay, let's discuss. Mantoux test is carried by intradermal injection of purified protein derivative extracted from tubercular bacilli culture. It is a sterile solution and does not contain live bacteria. Positive Mantoux test indicates prior exposure to TB. It is measured to cell mediated immunity and not of humoral immunity. Positive test does not necessarily mean good immunity. Okay. Now, anti-tubercular drug with maximum CNS penetration, that is isoniazid and pyrazinamide. That is isoniazid and pyrazinamide. Now, isoniazid and pyrazinamide have 100% CNS penetration and are important in treatment of tubercular meningitis. When TB is associated with AIDS, Mantoux reading is affected, or which one is the answer? CSF parameter is affected, first line management is affected, or tuberculosis is caused by atypical mycobacteria. So answer, I think it's Mantoux reading is affected. Let's see. Yeah, this is true. In an immunodeficient person, such as case of AIDS, cell-mediated immunity is deficient. Mantoux test detects cell-mediated response to individual to tuberculin antigen. Hence, the test will show lower induration, less positivity, rest of the parameters are not affected. Okay. Now, how do you get TB? Through air. Not by sexual contact, not by contaminated food, not by through blood. Tuberculosis is a airborne disease. Okay. Now, inhalation route we receive. Who is risk of developing tuberculosis in this country? People taking certain medicines, migrant from workers, or people with HIV. All have risk. Now, what makes TB hard to diagnose? That is, disease may take years to become active. This is very hard to diagnose of tuberculosis. Okay. Now, what are the symptoms of active TB? Weight loss, yes. Night sweat, yes. Loss of appetite, D. So all cause the active TB symptoms altogether. Now, how is tuberculosis diagnosed? By chest x-ray, yes. By sample of sputum or skin test, yes. So go for all. TB is diagnosed by all. Now, how is TB is treated? TB is treated by antibiotics. Okay, very easy. Now, what is causing tuberculosis to become a serious public health problem? Rise in number of people with HIV infection, yes. An increase in number of immigrants from areas of the world where TB is common, yes. It's increasing number of homeless people, yes. More people falling in finish their TB treatment. So E is the answer, all the above. Now, who in the US should receive a vaccine for tuberculosis? Infant, teens, adult under 65, adults over 65, none. There is no such criteria. Now, a scientist who discovered Mycobacterium tuberculosis was Robert Koch. Now, MDR TB is defined as resistance to isoniazid and rifampicin irrespective to resistance to any other drug. So this is the answer. MDR very high yield. Now XDR TB. It's MDR TB. XDR means extensive drug, extreme drug. We can say MDR TB also resistant. MDR resistant to fluoroquinolones and at least one of the three injectable second line drugs of TB like amikacin, kanamycin or capramycin. This is tuberculosis is transmitted through, as we already discussed, infected air. This is transmitted by inhalation route. Now, which of the following statement is incorrect? Every individual exposed to TB develops disease. It's not true. Those who are exposed to tuberculosis, they do not all are converting to disease. Now, Tubercular granulomas are made up of organized aggregates of immune cells that surrounded foci of infected tissue. Okay. Cord growth seen on mycobacterial culture characteristic of virulent strains. Now, which one of the following are constituent of Lowenstein-Janssen media except agarose? Now, following are the first line anti-tubercular drug except PAS. This is not anti-tubercular. First line. Which one of the following anti-tubercular drugs acts best in acidic pH? That is pyrazinamide. Now, mutations in CAT-G gene of Mycobacterium tuberculosis are responsible for resistance to isoniazide. Now, which of the following statement is incorrect? Cannot grow in free cell media. This is incorrect. Now, which one of the following is a non-cultivable mycobacteria? That is Mycobacterium leprae. It's non-cultivable. Now, Buruli ulcer caused by Mycobacterium ulcerans. Ulcer. So ulcerin cause ulcer, Buruli ulcer. Remember trick. Now, swimming pool granuloma is caused by Mycobacterium marinum. How to remember? Marine, submarine and marinium. Submarine in a water and marinium in swimming pool water. So this is a way to remember. Now, most common cause of disseminated opportunistic infection in AIDS patient in Western world is Mycobacterium avium intracellular complex. Now, which one of them is not acid fast? Actinomyces is not acid fast. Now, erythema nodosum leprosum as seen in patients of leprosy on treatment is due to type 3 hypersensitivity reaction. Now, okay, a 45-year man from Ecuador is starting work at hospital as a radiology technician. Per hospital protocol, he gets an IGRA test done. He immigrated 3 years back. It is positive. What is your next step? See options carefully now. Get sputum for culture? No. Chest x-ray to rule out subclinical TB history and pulmonary to check extrapulmonary tuberculosis. This is the right answer. Yeah, chest x-ray to rule out subclinical tuberculosis and check for extrapulmonary TB. Okay. Optimal treatment plan for latent TB infection, that is isoniazid for 9 months. Okay. Now, TB mortality is much greater in HIV positive patients. Yes. The patient with pulmonary tuberculosis typically present with the following symptoms. Check all that apply. Fever, night sweats, yes. Blood streaked sputum, yes. Anorexia and weight loss, but significant hemoptysis, no. This is no. Yeah, all three are right. Now, gold standard test for detection of Mycobacterium tuberculosis, that is isoniazid susceptibility testing. Now, classification of positive tuberculin skin test reaction part 1 match. Oh, this is not we are going to discuss. All suspected and confirmed case of TB should be reported promptly to a local and state public health authorities. Yes, true. It's true. Now, person with latent TB infection can still transmit the organism to others? No. Latent TB, no. Transmission. Scrofula is sometimes mistaken malignancy, Common form of extrapulmonary tubercular lymphadenitis, D, all. Yeah. Patient taking isoniazides should also be take daily oral pyridoxine B6 for prophylaxis neuritis. Yes, we have to give for tubercular patient. Yeah. Interaction with warfarin, oral contraceptive and digoxin, that is rifampin. Yeah. Warn patient that tears and urine might turn red or we can say orange color, that is rifampin. Yeah. Risk of loss of visual acuity and red green color blindness, that is ethambutol, E for eye and E for ethambutol. Now, after TB has been transmitted, how long does it take for body's immune system to be able to react to tuberculin? Select the best answer of choice, that is 2 to 8 weeks. Yeah. Which one of the following is a non-cultivable mycobacterium, that is Mycobacteria leprae? So guys, have a good day. Goodbye. That's all for today. I already finished with pulmonary tuberculosis MCQs. I cover maximum MCQs of pulmonary tuberculosis. Hope this will help you to crack exam. So please go through it. Thank you. Good day and goodbye. And if you like this video, please put like on it. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and